To say that so far I have a more optimistic view, but we will see how long that will last. Sorry, give me 1 second. Okay, so our next speaker is my friend Dr. Amjad Hammad, with whom by now I share too many WhatsApp groups. Dr. Hammad is an ophthalmologist and a Vitreo-retinal specialist in New York. He graduated medical school from Jordan University, the class of '93. He's American and Jordanian board certified in ophthalmology and has done fellowships in neuro-ophthalmology and Vitreo-retinal surgery. He also has an MBA with distinction from Yale University. Dr. Hammad is the founder and president of Eyes NY, a group practice, and he's the co-founder and owner of the New York Eye Surgical Center. He's a past president of the New York State Ophthalmological Society and currently a counselor at the American Academy of Ophthalmology, and he carries many academic titles. I have worked with him on multiple initiatives, including JAH, as well as some investments, and I find him to be patient, trustworthy, and obviously intelligent. He never hesitates to answer the simplest questions and always gives sincere advice. He is passionate about improving the healthcare system in Jordan, and he will talk to us today about how to pay it forward to Jordan's healthcare system.
Thank you. Thank you so much for such a generous and kind introduction. Thank you so much for everybody being here. I know it's a Saturday, it's a weekend, it's early in the morning. A lot of you traveled to come to Orlando. شكرا لضيوفنا الكرام. أهلا وسهلا فيكم. بتشرفونا بلدنا الثاني بعد بلدنا الأول هي طبعا الأردن. أهلا وسهلا فيكم. So زي ما حكى الدكتور بهاء, I am one of the oldest أنا الختيار تاع المجموعة. It's been a privilege and a pleasure to work with so many young people that are bursting with talent, bursting with energy, and they want to bring this back to Jordan. We have this in spades in the US. Many of them have accomplished wonderful, wonderful stuff here, and they've proven themselves again and again and again. And the idea is, how can we harness that energy and that potential, and how can we improve Jordan and healthcare in Jordan? As Dr. Bahat said, this is a spin-off. This is a completely different thing from JAPA. JAPA is the non-for-profit entity, organization that has been created in the United States to further the mission. And the mission is going to be elaborated again and again by many doctors, the different parts of our mission for JAPA. JAH is a Jordanian company. This is a spin-off. This is an effort or initiative to improve healthcare in Jordan. We're registered as a for-profit Jordanian company in Jordan. And I'm going to tell a little bit more detail about that. The idea is to reverse the brain drain. And you're aware brain drain is a term used in English to mean specialists or experts in a field that leave their country to go somewhere else. It's a natural phenomena, and it happens all the time in every single country in the world. Here we're trying to reverse it and bring that energy, as I said, back to Jordan. There are over 2,400, I believe they've reached about 3,000 Jordanian American physicians, represented by many of us here. We are a sample of the physicians that exist and work all across the United States. About 200 to 400 new residents. Dr. Bahat talked about how many people matched this year. Every year, our numbers are increasing. Many are experts in our fields. We have titles, we have positions, we have created entities and companies here in the United States. I'm not going to go over the JAPA story. Dr. Bahat talked about that in detail. Let's go back to Jordan. That's what we're going to talk about. Jordan has issues in the healthcare system. It has done much with very little. Alhamdulillah Rabbil Alamin. People have worked really hard in Jordan. A lot of them have put a lot of effort. They've accomplished so much. And now we're trying to see how we can do to help them. There are still issues with healthcare in Jordan we're well aware of. The fragmentation and the tiered system. We have a wonderful 5-star, even 7-star hospitals and doctors in West Amman. Not so many in other parts of Amman, not so many in other parts of Jordan. Muhafadat do not have the healthcare system that you have in West Amman. People in Jordan have a hard time identifying who provides quality care versus who doesn't. Every one of us gets 4 or 5 WhatsApp messages or phone calls a day from our friends, from our family. مين الدكتور الشاطر؟ مين بتعرف بيشتغل بالموضوع هذا؟ مين نودي؟ But they want to get this word of mouth. And most importantly, the last point, which we're going to emphasize again and again, the Jordanian healthcare system has no good primary care infrastructure. Anybody who has lived in the West, worked in the West, have seen how healthcare systems, it's a funnel, it's a pyramid. People come to the primary care doctor, their family medicine doctor, they get triaged. A lot of simple problems can be treated at that level. If it can't be, they're referred to the appropriate physician specialist that the primary care doctor knows will take care of the problem and be referred back to them when that problem is solved. We've had the honor of meeting with the Royal Court. We had the honor of meeting the King about 10 months ago. We had a discussion with them in detail. They put us in the framework of the vision for Jordan. If you look at the statistics of Jordan, we do pretty well. If you look at our healthcare, percentage per GDP, it's pretty reasonable according to the rest of the world. But if you look at the amount of dollar amount, because it's a smaller GDP compared to the other countries, we're actually not paying that much money per individual, per capita. And yet, despite that, our maternal deaths, our infant deaths are all excellent numbers. Life expectancy is very good. It's about 74.3. The amount of hospital beds per 1,000, these are statistics from 2-3 years ago, were still small or below the acceptable level compared to the world. We have a lot of challenges, external and internal. The amount of disease in Jordan is increasing. Non-communicable diseases, especially obesity and diabetes and smoking, is increasing at a very high rate in Jordan. We have a lot of undiagnosed mental illnesses, especially depression, anxiety in the population of Jordan. That's another critical thing that has to be addressed. Internal challenges, we're all aware of them also. This is nothing new to anybody who has lived in Jordan. We always worry and are concerned about the vision, the planning. Is there a strategic plan for healthcare, for the economy? There is a poor governance system and poor regulations. And of course, we know that the members of parliament here are addressing this on a daily basis in their job and working hard to resolve a lot of these issues. There is poor financing mechanisms, the insurance, and Jordan has signed on to the treaties to create universal health insurance. And that's the plan by 2027, 2028, I believe. And the Royal Court is working with that, with the legislator and with the executive branches of the government. And again, we're going to emphasize again, there's lack of balance, lack of reliance on primary health care. The pillars, the vision for healthcare by the Royal Court is improving health sector governance, revamping financing and insurance, and improving primary healthcare. So we've been working on this project, Jordanian American Health, for about 1.5 years now. We did a feasibility study that lasted for about 9 months. We did a market analysis, we did a competitive analysis, we did multiple interviews with experts at the level of the government, at the level of the WHO, the level of the USAID in Jordan, and we also done it with the private sector. The market analysis shows there's a shortage of skilled workforce, there's lack of coordination between comprehensive healthcare centers, there's not enough comprehensive healthcare centers by the Ministry of Health, and the ones that exist don't have enough specialists, they don't have enough equipment, there's not enough IT structure or coordination between them. So this is what we've done. We have created this company. This company is going to go to Jordan and is going to build several centers of comprehensive healthcare centers all across Jordan. We're starting in Amman. We're starting in South Amman to serve South and East and Madaba. And we're going to also be in North Amman, Irbid, Zarqa, and going south to Karak, Al-Aqaba. The idea is within 5 to 10 years, we're going to be across all of Jordan. And the plan is in 10 to 12 years to have about 12 large comprehensive healthcare centers as hubs and spokes, urgent cares and primary care offices in many of the Ahya al-Sha'biyya and the populated residential areas. We have a core group of founders of 63 US trained Jordanian physicians. We have been talking on WhatsApp and we've been interacting for over 1.5 years now. A lot of them are internal medicine, pediatrics, and family medicine, all eager to contribute to Jordan. We have talked to the Minister of Health. We have talked to Jordan University, Yarmouk University for public-private collaboration between us and them. We have discussed with many private hospitals that are all eager to work with us. We have looked at an initial location, and we have just been sent a contract, Amanat Amman, on 5 dunam land في ضاحية الياسمين. We're going to build a building in ضاحية الياسمين, which is going to be 5 levels. The first floor is going to be a primary care center. It's going to be urgent care, labs, imaging. Second, third, fourth floor are going to be centers of excellence. We're going to have selected specialties. For example, endocrinology and obesity, cardiology, GI, oncology, sleep medicine, pulmonary. We're going to bid this out to our doctors in the US and in Jordan, doctors in Jordan who wants to work with us. And we're going to have proposals from them for us how they would run a center of excellence. And we're going to select the best groups to be able to run each one of these to be able to manage and help the people in Jordan. So these are the different floors and the specialties they're going to have in. Each floor is a little larger than 2,000 square meters. So it's going to be a pretty large building. This is not a hospital, but it's a large outpatient center that will hopefully cover all aspects, as we said, of the critical care, the needed medicine that's needed to take care of the non-communicable diseases in Jordan. We will have, and it's 5 floors above ground and 2 floors below ground for parking structure as per Amanat al-Amman. So, next step, we have the 63 physicians. We have the initial funds to build the first building. We're going to expand in the next 2 or 3 months. We're going to reach out to all the doctors in Japa. Anybody that wants to invest with us, you'll be welcome to do so. We're going to expand the pools of specialists and physicians that want to join us for the Centers of Excellence. We're going to have a separate branch of our group that's going to be interested in just the real estate acquisition and development. So you can invest in just the real estate or invest in the medical program, and you can do it in both. And there's going to be, as we said, Center of Excellence selection. And there is a discussion to quickly move to Irbid with Zarqa, which needs these also. The core idea is to create jobs for people in Jordan. We're going to recruit workforce, skilled and unskilled, and we're going to train them to the levels, inshallah, of healthcare in the United States. And the premise is not to compete with the system with West Amman. We're not going in there to make a profit. We're there to help people. And therefore, the idea is to have quality care at affordable prices. We're going to have a sliding scale. The people who can afford to pay will pay at the level of certain naqaba or the lower level. The people who can't afford to pay will be in a sliding scale up to 0 payment. Everybody will be taken care of, and there will be sanduq lil marid al muhtaj, and 30 to 40% of our profits will be plowed back into sanduq al marid al muhtaj. So the idea is to assist and help and increase and provide health care for everybody who is underinsured or uninsured in Jordan in the next 12 years, with a public-private collaboration between us and the Ministry of Health wal Khidmat al-Tibbiyya. We want to create a modern, efficient healthcare system with affordable costs. The idea is to have also an academic mission. We're going to affiliate with the Jordan University, inshallah, Jamiat al-Yarmouk. We're going to create adjunct professorships to our physicians. We're going to train residency programs in primary care, family medicine, internal medicine, and emergency medicine. We're going to try to get accreditation for all our centers of excellence and for the residency programs for HGMAI, and work on rotating some of those residents through facilities that we're going to be working with here in the United States. It's not just physicians, nurses, technicians, therapists. We all know that none of us can work individually. We're part of a team. We have to create the whole ecosystem to allow quality care in Jordan. So we have to train those people to help us out. This is the board of directors. Currently, as Dr. Amal said, she and I both work in the board of directors. We have Dr. Ma'an Haddadin, Assam Abdul Kareem, Dr. Al-Nagam Abu Shaqra has been very helpful with us, and Dr. Munder Momini, Dr. Sama Abu Hlala. Everybody has put in. Sunday, we meet for an hour and a half, just to talk about this, and and we have ad hoc meetings, and it's been a job, another job beside the daytime full-time job that we have, but everybody's doing it because of our love and passion to make this happen in Jordan. Thank you very much.
Can we ask a question?
Sure.
Yes, sure.
Absolutely.
Ashraf Farasha, Children's National Hospital, Washington University.
والنعم.
Dr. Amjad, thank you so much. This was a brilliant presentation. I know that you are coming for a for-profit organization, but I think it's really important for all of us to have the narrative part. They are physicians who were trained in Jordan, who are so proud of being from Jordan. They can say with their training. Many of us have led successful careers. I recently was invited to give a talk to my own fellowship program, celebrating 3 years of the program. And I shared with them the things that I have done. As a Jordanian physician, working at the Washington University, and many countries abroad. But the thing that impresses me the most were people who live in the I have to use a way to and he shared with us how the lack of equipment, the lack of infrastructure did not stop them. They were able to succeed, and they were able to do amazing work. I work in congenital heart disease. My kids that are born with half of their hearts, they have to have surgery by 3 years of life. Their operations are done at day 4 of life. It is so ridiculous. The equipment in the state is so sophisticated. The cost here is around 100,000. In India, we're getting people giving the same operation for a cost of $2,000 with not that much difference in mortality. So now, if I want to go back to the question, my question is, when you present like this, you're sending a good message to the people that you believe in the healthcare system, that you are willing to invest your time, money, and effort to go there. Can you tell me, how did you come to it? And thank you.
How did I come to what? I'm sorry.
To the conclusion that it's worth investing in Jordan, that the health system in Jordan is great, that you can still continue to go there and work on it.
It's better than that. Jordan's in our hearts. So even if we felt that there was going to be a hard fight, it's a fight worth having. That's all. But it's not going to be that hard. Believe me. Every time I've gone back, I've talked to people who are responsible, people who are in different positions, and the people that are in private practice. Everybody is eager for something to improve in Jordan. There's a hunger and a desire in Jordan for improvement. We have a good team. We have good people that are going to be working with us. Now, let me go back a little bit. When we first went back, we thought we were going to do a non-for-profit charity. That was our initial idea, because that was going to be our mission. But everybody we talked to, lawyers, accountants, and business management consultants, have said that the for-profit model is better because that way we can create a margin, we can create a little profit that's going to plow back into the mission, and that way it can be sustainable without us asking for donations. I think we never thought already that this was not something that was worth doing, why we should do it, because the reasons are evident and clear. Something has to be done. If it's not us, who will do it? And we have people in Jordan that want to help us with this. So no brainer.
Thank you so much.
دكتور بس انا بدي اعطي تعقيب سريع هي من الاشياء اللي ساعدتني ارجع انه انا شفت ناس بدول كثير ثانيه بامكانيات كثير اقل من الاردن they didn't hesitate to go back to their countries and participate وحتى في ناس من الامريكان natives they went to these really underserved countries and they didn't mind at least trying. We're not saying that we guarantee success, but we just felt it's worth at least to try. We have a 15-minute coffee break, so please. And please don't forget to stop by the exhibitor booths. We really enjoy it. Thank you.